Dr. Nguyen, let's talk about Massey's 50th anniversary. It means so much last year when we were designated as an NCI Comprehensive Cancer Center.
I think we all are part of the Massey family, the mission of the ethos that with resources, we can. There ain't no mountain high enough. There ain't no valley low enough that can keep us actually from doing the work. And we have a track record of 50 years of showing that.
Going all the way back to Dr. Lawrence, who founded the first cancer center here. We've always been thinking ahead to how our research can actually impact people's lives. We had the first bone marrow transplant program, which has evolved over the years. They also were pioneers in bringing the so-called engineered T-cell or CAR-T therapy, which is so impactful in a lot of types of cancer.
Not many cancer centers are able to take medicines that they discovered in the lab and show that they work in patients. Under the leadership of Dr. Ginder and now Dr. Nguyen, they're already invested in this area. Molecules to Medicine allows our Massey faculty members to really reach those different steps along the drug discovery pipeline.
Not only generating new knowledge and new breakthroughs of both technology and molecules that become miracle medicines, but the science of how to actually get that to more people to save more lives. Look how far we've come in changing the national discussion in how to bring science and accessibility of that science to our community.
Yes, to everyone.
To everyone. When it comes to things like our early years of being in the rural areas with Dr. Helen Hackley and many of these other rings, right? We take it for granted now, but that was new.
We were practicing that kind of advanced treatment of breast cancer into places like Farmville and South Hill, Virginia, long before places like New York City were accepting it as a standard of care. So I used to say, if you have friends in New York who want the state-of-the-art treatment for early-stage breast cancer, they should come to South Hill, Virginia.
Massey's engagement with the community is real. Massey leaning into health disparities, having diversity in clinical trials, all of these are really important in trying to advance overall health outcomes and actually shoring up health equity. The Facts and Faith Friday initiative was helpful in building trust with the medical and scientific community. We talked about a number of inequities about the most marginalized and the most vulnerable in our community.
Particularly Dr. Lawrence once who said, he goes, the best thing is to make sure that the science and techniques that we have benefit the maximum number of people that we can.
What you have brought to us in the last few years is going into the community and finding out what the needs are.
Having my mother have cancer and I have cancer, the care that happens at Massey is really unique. They want to really understand what that person is needing and what they're going through.
The whole idea of treating the whole patient, that goes back to Susan Millett, who was really a pioneer in that area.
It's not just about the cure, it's about the healing. Healing comes with survivorship. That the peripheral neuropathy you now have from the drugs,
yes.
The issues you have with the heart
yes.
or hearing, that we also now have a science that we're investigating so that tomorrow those aren't issues. That research is happening today.
When I was first diagnosed with breast cancer, the first thought I had in my mind was, I'm gonna have a mastectomy because that's what my mother had, that's what my grandmother had. The fact that there's been, again, so many advances in cancer treatment allowed me to be able to make a decision where I did not have to remove my entire breast. That right treatment came out of clinical trials. So for a triple positive person, had I been born 30 years ago, I may not be here talking to you. To say that there have been advances in cancer treatment, that's just an understatement.
I knew that this disease was so much bigger than me, and if I could be part of solving something for your health or for the mental health, I wanted to do whatever I could. And so we said we need to create the healing space. People can escape what they're dealing with, have classes there, and it's a place you can go meditate.
It was a seed idea that was brought from community members, survivors who care, who also understand how nature heals.
We have other larger cancer centers now coming to find out what we've just done with our healing space, because it's not just a pretty room, it's a space where you can reflect and you can heal.
Our first campaign to open Goodwin. This is basically where today's logo originated from, this design.
Well, oh, how much fun, how much fun.
To watch what has happened and seeing it today is just so heartwarming.
You know what's been central to this? It's been the belief of actually having folks in the community know what we can do and encouraging us to even do better.
After doing this myself for 4 decades, I can tell you that there's never been a more excitement about what's possible.
We're now looking at interception. The use of these mRNA vaccines, not only to, quote, fight COVID, which most people know them about, but the repurposing of those vaccines in the context of identifying people through biomarkers and other things that are most at risk, and the treating and delivering of vaccines is amazing.
Liquid biopsies. This is probably something that is going to revolutionize cancer, because if we're able to find biomarkers early enough, we would be able to diagnose early, prevent cancer even before it occurs, or at least preventing it from metastasizing.
We're building on our 50-year record, doing more clinical trials, more research, and more collaboration to bring our science and our communities together.
We have direct access to state-of-the-art treatment, direct access to clinical trials, a hospital that doesn't turn away anyone, regardless of their economic status. So I think that's a great achievement.
Everyone has stepped up. It's everybody equally feels a part of this. Everybody is engaged. We are a true team. It's just so exciting. I can't wait for the future.
Well, the next chapter, you read the past one, the new chapter is going to be even better.